Figuring out how prescriptions work in the United States healthcare system can be a little bit confusing, so we're going to try to do a few videos to help you understand. The first step in accessing prescription medications in the United States is meeting with a prescriber. At ClearDoc, we do that through telemedicine. And so you'll have an appointment with your clinician where the two of you will decide what treatments are the best option for you, and then your clinician will send a prescription electronically to the pharmacy of your choice. Next step in picking up that prescription is calling your pharmacy to find out when they'll have it available for you. Availability depends on whether or not they stock the medication or have to order it in, how busy they are with other prescriptions, and cost, payment, insurance type stuff. Once they let you know the expected fill time, you want to ask them if you have insurance to run a test claim, which will let you know what your expected copay is. If you don't have insurance, you'll want to ask them for the price on that medication, so you have an idea of what you're going to be paying when you get there. If your copay is too high, or it's not covered by your insurance, a couple of options are to have the pharmacy start a prior auth and send that to your clinician or prescriber. Alternatively, you can see if it's actually just cheaper to pay without insurance and use something like a GoodRx coupon or a cheaper mail order pharmacy. So now you know how much it's going to cost when it's going to be available. So you actually have to go to the pharmacy to do that. So if they said it was going to be available for you tomorrow after 12 p.m., swing by that pharmacy tomorrow after 12 p.m. You will want to bring photo identification and an insurance card if you have those available. You'll walk up to the pharmacy counter, get in line for the pickup medications, and then answer the pharmacist's questions. If you feel like you're having a discriminatory experience with a pharmacist, that sucks, and you should definitely report them. And so there are some options to do that as well. If when you get to that counter, your medication is too expensive, right, there are a few options. Like I said, try not using your insurance and just paying cash and asking for any coupons available, or using the GoodRx app. They have coupons you can use as well. Alternatively, Cost Plus, Amazon, Honeybee Health, they're all mail order pharmacies that do lower price cash pay on generic medications. Some trans nonprofit organizations also do funding for emergency HRT access, so that's something to look at as well. And sometimes your medication needs something called a prior authorization, which means your doctor has to fill out more paperwork for your insurance company to try to get them to cover it. You should try to troubleshoot the pricing and the cost as much as possible before you talk to your clinician with the pharmacist, because you might actually be able to solve the problem yourself and not have to go back and forth with your prescriber, which always slows things down. Sometimes there's no way to troubleshoot that cost problem in a way that gets you what you need, and so your prescriber might need to get involved and actually change the prescription. And so usually the pharmacist can reach out to your clinician to start having that conversation. You could shoot your prescriber a message in our direct messaging just so they know to expect that call. If you're using a mail order pharmacy instead of an in-person pharmacy, it's a kind of a similar process. Your prescriber sends a prescription electronically to that pharmacy. The pharmacist reviews it. They may contact you to get more information or find out to confirm your shipping address or get any kind of payment from you, or verify that your copay is something you're comfortable paying before they ship it to you. We work with Honeybee a lot, and they actually just send you an email once things are ready to be shipped. Is it time for refills? Fabs. At ClearDoc, most of our clinicians send prescriptions to get you through until your next appointment. And so you really usually should not have to contact your clinician for refills in between appointments. If you do, something is maybe gone a little sideways or wonky. So we always encourage all of our patients to actually start off by talking to their pharmacy. I know in this day and age, it's a little bit odd to actually call someone and talk to them instead of using an automated system or an online refill system. But a lot of times at ClearDoc, we don't send refills on meds. We send a new prescription at your previous appointment. And so your current bottle will show 0 refills available, even though there's actually a prescription there waiting for you. And the automated systems don't realize that. So it really takes working with a human pharmacist or pharmacy technician to find that prescription and fill it for you. We definitely recommend actually talking to the pharmacy technician or pharmacist before checking in with your ClearDoc clinician. because it will probably save you time. The pharmacy is staffed, 5 days a week, maybe 7, depending on the pharmacy. Whereas our QueerDoc clinicians, right, we respond within 3 business days. And so you'll get a faster response time on refill status if you go straight through your pharmacy. Ultimately, we're always here to answer questions. So if you check out all these videos, try all these tips and tricks, and are still struggling to get your prescriptions filled, definitely shoot your clinician a message, right? We're a small team and we do have to keep like a healthy work-life balance. So we will respond within 3 business days. And I know sometimes medicines feel urgent or emergent. And when you're running out, it's really stressful. We try to avoid that for all of our clients and patients at QueerDoc, very specifically by, trying to provide enough refills to make sure you have enough to get you through to your next appointment with us. But we always want to be available. So send us your questions, concerns, or confusions.